The United States Preventive Task Force announced last week they're now recommending women begin breast cancer screening at age 40 instead of 50.
They also recommend the screening happen every other year. Health officials share the benefits of this change. Texas Oncology Amarillo Cancer Center's Dr. Lova Arenivas says the new recommendation comes after the task force realized more lives could be saved with screening beginning at age 40.
In the United States, 1 in 8 women will be diagnosed with breast cancer. In the Texas Panhandle, that accounts to approximately close to 600 new breast cancers a year and about 110 or so women dying for breast cancer a year is what's estimated for the last year.
Arenivas says signs to look for are new lumps, skin changes, nipple changes in discharge, and lumps in the armpit.
There are some genetic predispositions. If a woman has a strong family history of breast cancer, particularly in first-degree relatives such as a sister or mother or daughter, or women who have male relatives who've had breast cancer, they tend to have more genetic predispositions, and so they should let their providers know and the doctors know so that they may be evaluated at a high-risk clinic.
If a first-degree family member was diagnosed with breast cancer, Arenivas says screening should begin earlier.
If a woman's first-degree relative was diagnosed with breast cancer, for example, at the age of 40, we would recommend that she start screening 10 years before that person was diagnosed.
According to USPSTF, African American women are 40% more likely to die from breast cancer than white women. And although cancer can't be prevented, there are ways to lower the risk.
In terms of breast cancer, the big factors are maintaining healthy body weight, decreasing alcohol intake, exercising regularly. Those are some of the top 3 things a woman can do to decrease her risk of breast cancer.
Dr. Arenivas adds that she recommends screening annually instead of every other year, and that women begin talking with their providers at age 25.
She also says patients should discuss their personal history and risks to develop strategies for breast cancer screening. You can read the full report from the Preventive Task Force.
Plus, learn more about the breast cancer prevention and screening from Texas Oncology. Just head over to myhighplains.com.